Hypertension is the measured change in pulse and resting phase pressure in the peripheral circulation. The heart is pumping against blood vessels that should respond to the heart. In a healthy circulatory system, blood vessels provide about 3/4 of the pump action, moving the blood, oxygen and nutrients to the peripheral tissues. All of the blood flow back to the heart results from the peristaltic wave of contraction of veins back to the right side of the heart. To lower blood pressure, we must improve blood vessel secondary wave of contraction and support mitochondrial metabolism that makes up 3/4 of the muscular middle layer responsible for the flow. To lower blood viscosity is also essential. We need to reduce free radicals that make vessels stiff with oxidized plaque from fatty acids and cholesterol that has been damaged. Singlet oxygen radical, hydrogen peroxide radical, and nitroperoxide radicals must be quenched. A byproduct of inadequate metal group transfer from folate, B12, and metal group deficiency is homocysteine, and this must also be reduced to prevent vessel wall injury. Cholesterol is not dangerous to the artery, but small particle HDL and VLDL3 can be swallowed by macrophages and die, becoming plaque, forming foam cells. They release local molecules that can cause fibrin and platelets to aggregate like tar. There's many different factors that can contribute to hypertension, like your genetics, environmental factors, inactivity, too much salt, stress, nutrient deficiencies, age, alcohol, caffeine, smoking, and being overweight. As sugar is an inflammatory substance, a low carbohydrate or low glycemic index diet should be adopted. As salt increases blood pressure, table salt should be replaced with sea salt or Himalayan pink rock salt, as the micronutrients in these may have some benefits. As well as their many benefits, such as improving mood and cognition, omega-3 fish oil contains both DHA and EPA. These fatty acids are essential nutrients that are important in preventing and managing heart disease. Findings show that omega-3 fatty acids can help to lower blood pressure. Common doses range from 3 to 9 grams per day of an EPA DHA blend that's molecularly distilled from fish oil. Magnesium is a mineral that's critical for many bodily functions, including blood pressure regulation. Studies show that magnesium supplements can help to reduce blood pressure by increasing the production of nitric oxide, which is a signaling molecule that helps to relax blood vessels. In order to best determine your dose, slowly increase the amount of magnesium bisglycinate that you take each day until side effects such as diarrhea or stomach discomfort are noticed. Then gradually reduce your dose until you're taking the maximum amount that doesn't cause any digestive discomfort. As magnesium is required by hundreds of enzymes in your body, it can produce profound health benefits after a few months of supplementation. As well as magnesium, zinc is also required for the proper functioning of around 100 enzymes in the body, and zinc deficiencies are common. Lower than normal zinc levels may contribute to high blood pressure, known as hypertension, by altering the way that the kidneys handle sodium. So be sure to get the recommended amount, which is 30 to 50 milligrams per day of zinc, and make sure that the form of zinc is a highly absorbable form. It was concluded that a vitamin E supplement of around 200 international units a day can be effective in mild hypertensive patients in the long term, probably due to nitric oxide and improving the blood pressure status. Make sure that you get a mixed tocopherol natural form of vitamin E and not a synthetic one. An Italian study in 2013 reviewed the role of vitamin D supplementation on regulating the blood pressure in the body. Vitamin D may be more effective in lowering blood pressure in people who have low levels of vitamin D, and most people are deficient in vitamin D anyway. You can get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3. Vitamin D works synergistically with vitamin K. Low levels of vitamin D and K were associated with increased blood pressure and a trend for greater hypertension risk. Vitamin K1 is primarily involved in blood coagulation. Vitamin K2 has a more diverse range of functions. It was labelled as Activator X by the dentist Weston Price, who was studying the relationship between diet and health problems, and he considered it to be one of the most overlooked essential nutrients in our diet at promoting good health and longevity. The maximum amount that your body can absorb in a day is 300 micrograms. Therefore, more than this is not necessary. Glutathione is known as the body's master antioxidant. Glutathione is a major intracellular thiodisulfide redox buffer, and it serves as a cofactor for many antioxidant enzymes. Glutathione-related parameters are altered in hypertension, suggesting that there's an association between the glutathione-related redox system and hypertension. You can increase glutathione by taking reduced glutathione at up to 1 gram per day, taking N-acetylcysteine at 500 milligrams 3 times per day, ensuring that you have adequate selenium, for example by eating 3 Brazil nuts per day, taking the herb milk thistle, or eating asparagus. Dietary intake of vitamin B6, B12 and folic acid has been reported to reduce the plasma homocysteine levels. These vitamins may have an influence on blood pressure levels by mediating the effects on the homocysteine level. B1, thiamine, also has beneficial effects on blood pressure of individuals with hyperglycemia, as it lowers the diastolic blood pressure and the mean arterial pressure. You want to make sure that you get a quality multi-B vitamin with B12 in the form of methylcobalamin. In an analysis of 12 clinical studies, researchers reported that coenzyme Q10 has the potential to lower systolic blood pressure without any significant side effects. Doses can range from 200 to 400 milligrams per day. Coenzyme Q10 works synergistically with PQQ, and typical doses of PQQ are 40 milligrams per day. Ubiquinol is the more powerful form of CoQ10, which is more powerful than ubiquinone. Hypertension is responsible for at least 45% of death due to heart disease and 51% of stroke. This is according to the World Health Organization. L-citrulline is a non-protein amino acid that's been investigated for lowering the blood pressure. Citrulline produces several important effects in the body. One major way it works is by increasing vasodilation. Vasodilation refers to the widening of arteries or veins, and it's associated with lower blood pressure and increased blood flow. Some research has also shown that oral L-arginine can lower blood pressure in healthy people and people with mild blood pressure and diabetes, and also in people with the type of high blood pressure that affects the arteries in the lungs and the right side of the heart, known as pulmonary hypertension. Typical doses are 1 teaspoon of each, mixed in a glass of water. This can be sweetened with stevia and taken once or twice a day, either first thing in the morning or last thing at night on an empty stomach, or taken twice a day, meaning in the morning and the night on the empty stomach. Beetroots contain naturally high levels of nitrates, which your digestive system converts into nitric oxide, and this compound relaxes and widens blood vessels, which in turn lowers blood pressure. Cayenne opens up blood vessels and helps to increase blood flow. This decreases the blood pressure naturally by increasing the rate that blood flows through the system. Dr. Christopher used to add cayenne to all his formulas as he believed that it improved every health condition in the body. Garlic supplements have shown to be effective in reducing blood pressure in hypertensive patients, similarly to the first-line standard antihypertensive medications. Kyolic garlic, which is fermented, has also been shown to improve cardiovascular health by reducing arterial stiffness, reducing elevated cholesterol levels, and reducing blood stickiness. Hawthorn is used to help protect against heart disease and to help control high blood pressure and high cholesterol. Both animal and human studies suggest that hawthorn increases coronary artery blood flow, improves circulation, and lowers blood pressure. As hawthorn is closely related to apples, it's often consumed like a fruit in high quantities. Some consider hawthorn to be an adaptogen, with the berries supporting the physical problems of the heart and the flowers supporting any emotional imbalances of the heart. High levels of stress can also increase blood pressure and cause hypertension. Some herbs that can help. You have valerian. This can have a sedative effect, but it could also have a stimulant effect for the extremely fatigued. Valerian root may lower the blood pressure and relax the muscles. You have passion flower. Blood pressure levels were significantly reduced, which was likely due to the GABA effect, which is gamma-aminobutyric acid promoting properties of the plant. And passion flower also has an antioxidant enzyme that helps to lower blood pressure. You have theanine from green tea. This was shown to decrease the blood pressure in the systolic and the mean blood pressure, but the heart rate was not affected by various doses of theanine. Bilberry can lower blood pressure, reduce LDL cholesterol, increase HDL cholesterol, and protect you from blood clots, thus improving the heart health. According to scientists from Johns Hopkins University's School of Medicine, high doses of vitamin C, which averaged at 500 milligrams per day, can produce small reductions of blood pressure. Vitamin C may act as a diuretic, removing excess fluid from the body, and this can help lower the pressure within your blood vessels. The best form of vitamin C is liposomal vitamin C. Then the next best would be a pH buffered non-acidic vitamin C, with the worst kind being a cheap acidic ascorbic acid. Vitamin C's action is enhanced when it's taken with flavonoids. Flavonoid compounds, including flavonols, flavones, and isoflavones, represent an important source of antioxidants in the diet. Lowering blood pressure through increasing dietary consumption of dietary antioxidants may decrease the rate of end organ damage, which is secondary to hypertension. Taurine is a type of chemical called an aminosulfonic acid. It occurs naturally in the human body, and it has many important functions. Taurine is found in large amounts in the brain, the retina, the heart, and blood cells called platelets. The best food sources are meat, fish, and eggs. Taurine has been shown to lower blood pressure in several hypertensive animal models. Doses tend to be around 1 gram taken 3 times per day. As the main cause of hypertension is diet and lifestyle related, you should exercise, eat a healthy diet, and learn to safely manage your stress levels. You should try to give up bad habits such as high salt and sugar, and stop smoking. Never assume that the damage is already done and that it's too late to change and heal. You can take the herbs and supplements to help speed up your healing, and you can also learn to incorporate these healthy herbs and foods into your diet to maintain a healthy blood pressure. You can check out my series on weight loss for more information on cholesterol and blood pressure. And you can check out my video on mitochondrial boosters, as mitochondrial function is important for heart muscles.